But Tonya has been doing some amazing work and really helping to also rethink how we can have healthy babies. And we're very delighted to have her here today to share her thoughts with us. So I give you Tonya Lewis Lee.
And Rita and everyone here at Women's eNews for having this today, and also for your work on the Black Maternal Health Project. I think it's fantastic. We need more. Everybody needs to be on board, as you were saying. It is, the question is why me and why this issue, right? I mean, after all, I am married to Spike. I do write and produce. I have another life. But I have taken on this issue of infant mortality as something that is really deeply important to me, and I feel like should be really deeply important to the entire country. The Office of Minority Health came to me about 3 years ago and asked me to be the spokesperson for this campaign to raise awareness about the high rates of infant mortality in this country, and in particular in the African American community. And when they reached out to me, I really had no idea that we ranked 29th in the world in terms of infant mortality in this country. And I had to really get involved. I was really fortunate. I had 2 wonderful pregnancies. Both of my children went full term. They were not low birth weight babies. And I just think that should be the right of every woman to have the opportunity to have the kind of experience I had. So in the first year of the campaign, we traveled around the country doing exactly what we set out to do, spread awareness. I would go to health fairs. We had people from the local Department of Health speaking about the issues of infant mortality in the local town, because each city has their own unique, or each rural area has their own unique thing going on that affects what happens with a woman as she's pregnant and having her children. So, the Department of Health would speak to their specific issues. We had someone from the Office of Minority Health who would speak about the statistics of infant mortality. And then I would talk about, what women could do to be healthy just before they were getting pregnant or when they were pregnant. So things like, going to the doctor, watching what you eat, don't drink, don't smoke when you're pregnant, putting the baby on their back when they sleep, breastfeeding, all of that. And I think in the first year we felt pretty good that we were raising awareness, but we felt like we needed to do more. And also we knew that we had to reach women before they were just about to have a baby or before they were pregnant. And so we instituted a program. We piloted a program in, I guess it was August of 2008 at Howard University. We went to 4 colleges and developed this preconception peer educators program. So we went out to college students and we said, the Office of Minority Health developed a curriculum. And they said, look, we want you to be the health advocates. We want you to learn about infant mortality, learn about advocating. And so they came, they got information from doctors who were obstetricians, pediatricians, general practitioners about health and well-being. We gave them our materials, which were A Healthy Baby Begins With You materials. And we said, go to your college campus, take our materials, and make it work for your community. So, for instance, if I were the one to go to a college campus, I guess initially I would have thought, all right, I'm going to maybe put some posters up, put things up on the post board, so kids could. But that's not how college kids communicate anymore. So our kids were like, forget that. You got to get on Facebook. You got to do the social networking. As I said, the campaign is A Healthy Baby Begins With You. They were like, healthy baby isn't going to resonate with young people. You got to get the baby out of there. It's a healthy you. And so it was great because they took our campaign and they made it work for the kids who they were speaking to. And so they had health fairs at their college community. They also had to reach out beyond the college community and talk to young people in high schools and in middle schools in the areas in which their schools were located. And I have to tell you, the one thing I know is that the youth are going to be the ones that save us. And I think they get, young people just don't get enough credit. These kids, we were at Spelman, Fisk-Meharry, Morgan State, and University of Pennsylvania's nursing school. And these kids took this campaign on with such energy and vitality, and really made it work. And I attended some of these some of their health fairs. In particular, there was one at Morgan State where they brought the high school kids to the school, and the way, just the interaction, when you have a college kid talking to a high school kid about health and the future of their life, because part of the, I think, and as Rita mentioned, a big part of the issue with infant mortality is figuring out why African American women are having such a low birth weight babies or premature babies. But I think, when you're talking to young people, about making healthy lifestyle choices, it's also about, you've got a lot of work to do. There are things, we depend on you, and you need to be healthy in order to do what it is you need to do in your life. And when you have these college kids talking to these high school kids about their future and what's out there for them and how they need to be healthy so they can contribute to their society, it's an exciting thing, and I've been really fortunate to be a part of it and witness how powerful our young people are. I really feel like we're in good hands when I think about the youth, and I think we all should really think about how to engage young people more, not just telling them about making healthy lifestyle choices, but empowering them to contribute to their society and to make a difference. They're looking for that, and when you provide that for them, it's amazing what they can do. So, this year we piloted the program on 4 college campuses, and now we are doing regional training. I think the campaign has become something more than what we expected. In September of this year, we're going to have a big conference in Chicago, and I think we're looking to have like 400 or 500 college kids. We're 20 schools in 5 different states will come to Chicago. We'll have people who will come and train them, professionals, healthcare professionals, who will come and train them on the issues of infant mortality and health in general. We'll do a community outreach. We'll go literally knocking on doors. We'll do a big health fair there in Chicago. We did this before. We were in Memphis, Tennessee last year, where we did do a community outreach, which was really successful. I find that what we're trying to do is we're the federal government who goes into a local place and gets with the local government. So we get with the Department of Health, we get with the mayor's office. We all partner together to really make a difference, because I think that's what it's going to take. So it's the federal, the local government, local businesses that can all contribute and come together, faith-based organizations, so that we all come together around this issue. We go in, we work with the local area, and then we go, but they've got the momentum on which they can build for their communities. And Rita talked about, figuring out, and Kimberly, about figuring out why we are in this, why is infant mortality such a big issue for African American women. And when I first started this campaign, it was just, first of all, that there was an issue to begin with, was striking, and then again trying to figure out what this is about. And I mean, I've had the great fortune of meeting so many amazing doctors out there who are doing great work, who are doing cutting edge work. I think that the issue of racism is something that is now being taken seriously by healthcare providers, that the level of stress that African American women have is something that really is affecting the way their children are born. It's not just one generation. I think we carry the weight of our ancestors often. So there's a lot of research going on there, and we need more and more research to figure this out. Of course, it's also access to care, access to quality care, the kind of care you get when you're there. So my take on this is, we all have to do what we can do to bring these rates down. The individual has to do what the individual can do. I'm a big believer, and a large part of this campaign is making healthy lifestyle choices. So, we as individuals, it's hard out there. As Kimberly said, there's so much information that we get from so many different places, but we really do have to figure out how to take care of ourselves, and that's really about getting an education about it. I mean, I have to learn, I'm always learning about, how to take care of my health. What does it mean to really be healthy? At the same time, we need to advocate for our communities. We need to advocate for places where people can have safe places to exercise. We have to advocate to bring in healthy fruits and vegetables to communities that don't have it. We need to push our government for reform. I mean, I was excited with the healthcare reform. I hope that really does make a difference. But just because that passed doesn't mean we're done. I mean, we got to keep pushing them to make policy changes that will affect our communities. So I think it's an approach that goes from the top to bottom, bottom to top. And I believe that we can really make a difference. We did a documentary on our campaign called Crisis in the Crib. It's on the campaign on infant mortality. And one of the students in the film says that we wouldn't be doing this if we didn't believe we would make some kind of change. And I mean, I wouldn't be doing this if I didn't think I would make some kind of change. I have a really crazy, busy life, a 15-year-old and a 13-year-old. So you know what I'm going through. Maybe that's why I like to get out on the road every now and then. But I wouldn't spend my time. I don't need this. But I was called, and there was no way I could turn my back. And my community, all those children that are lost, we all feel it, whether we know it or not. There are resources that are lost, and we just all have to get in there and do what we can. So I thank you guys for coming. I thank you for listening, and I guess Kimberly's going to introduce Mark Lou. Thank you.